Malaria is an infection with one-celled protozoans called plasmodia. Plasmodia spend some stages of their lives in female Anopheles mosquitoes and some stages in people. A female mosquito sucks in plasmodia when she takes blood from a person infected with malaria. In her intestine, male and female forms of plasmodia combine into zygotes. Zygotes burrow into cells in her intestine and form tiny cysts. Within each tiny cyst, the zygote divides many times. Eventually, the tiny cyst bursts, and plasmodia migrate to the mosquito's salivary glands. She can now inject plasmodia into a new victim. In people, plasmodia first travel rapidly through the bloodstream to the liver. They invade liver cells and again divide. The liver cells eventually burst, releasing thousands of plasmodia back into the bloodstream. The parasites next invade red blood cells, where they divide again. They release more plasmodia, which in turn infect more red blood cells. Each time the red blood cells rupture, the person suffers an attack of chills and fever. Some of the plasmodia eventually develop into male and female forms, ready to infect another mosquito and continue the cycle.
So here we have another picturing medicine diagram here. This one illustrates the different causes for fever in a child. And as with all the diagrams, the best thing is to remove the labels, and this creates for you a very stark, visually associative and colourful image which will help with recall of information by using the power of your visual memory. So we'll start with the various causes on the left-hand side, and I'll talk you through this. So we've got up here, we've got viral infections, common cause for fever, inflammation of the meninges, meningitis, potentially a rather serious condition and the cause of fever. Otitis media, ear infections, tonsillitis, chest infections, and don't forget tuberculosis, which tends to cause infections of the upper lobe of the lung. Cellulitis, infection of the skin. Infection within joints, septic arthritis. And gastroenteritis, and urinary tract infections as well. And then the other causes which are on the less common cause side: malaria, transmitted by mosquitoes. So consider if the child's been abroad, for example, and may have contracted that. Familial Mediterranean fever. Vasculitides such as SLE, systemic lupus erythematosus, illustrated here by the classic malar or butterfly rash across the cheeks. Hematological malignancy, so leukemia, may present with fever in a child. Kawasaki's disease, which is also associated with inflammation of the coronary vessels, which can actually lead to myocardial infarction. Typhoid, bacterial infection. Inflammatory arthritis, occurring in a child. And finally listed at the bottom here is fabricated or induced illness, where the parent is actually responsible for the unwellness of the child. So, as I say, we can show you the labels, which helps to clarify all of the different illustrations. The best thing is to remove those labels and to carry with you this stark image, which you can use to recall all the information that you need with precision and with confidence when you need it.